Every nursing student dreams of passing the NCLEX-RN, but what separates those who do from those who don't? It's not luck, it's preparation. Hey guys, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from what to the why. The why here is centered around those factors that have been shown to be predictors of success for first-time takers of the NCLEX-RN. Now, before we jump into that, let's take a minute to look at the trends and pass rates for first-time test takers from the United States. So one of the things that you'll see from this table that I put together for you is over the past 10 years, going back from 2024 to 2015 here at the top, in the middle row, in the middle column, you see that's the first-time pass rates, and then over on the far right are the number of first-time test takers. And what you see going down throughout the last 10 years is something that's really good and encouraging from my perspective. A fairly stable overall performance on this exam from first-time test takers in the mid to upper 80s. There was this one particular area right here during the pandemic that it fell down a little bit, that probably raised a little bit of concern, but that was due to interruptions in the way people were able to learn. Clinical practice was disrupted. That's not necessarily entirely obviously reflective of students, but rather the environment that they were put in. But you can see it quickly recovered and has continued to go up, breaking 90%, which is excellent. I think the other important thing to observe here is over on the far right, you can see that the number of people taking the exams has increased significantly. That's excellent. Not only are the number of people increasing in the profession of nursing, but the scores are going up. I think that reflects a really strong performance and demand of the profession. So kudos to the nursing profession. But when you still look at these first-time pass rates, those are first-time test takers, right? So when you include people who didn't pass, or obviously international and other people, then that does drop some, okay? So when you take the totals of people, right, that's going to be, somewhere between 10 and 15% of people are still not going to pass. Well, why is that? What are some of the predictors that can allow us to sort of assess our own situations as you're preparing for that exam? What are things that you can influence now, especially if you're starting really early? And what are some of the things you can't influence, but you might adjust your study plan so that you can be one of these statistics of success? So the first indicator or predictive factor is not one that's going to surprise probably many of you. It's academic performance, right? It's actually considered one of the stronger predictors, especially for those, when you look at the GPA of the science side of your grades, those people that have a GPA of greater than 3.5, or their overall nursing GPA is greater than 3.0, correlates to 85 to 95% pass rates. Next would be the performance on standardized exams. Those include things like your annual assessments, exit exams, your ATI, HESI exit exams. Those also have strong performance in predicting those who are going to pass, which is why your institutions many times use those. It also, as you might expect, shows that when people score on the low side, typically less than 60%, that the risk of failure is increased by 3 to 5-fold. What about demographic factors? Well, age has actually been pointed to as being a predictor of success. Those who are older, okay, typically over the age of 25, have shown higher rates. Why? Well, the discussion points have been largely centered around experience in life and overall maturity, probably also increased levels of discipline. Now, that doesn't mean that younger folks don't have maturity or discipline, so don't be offended by that. It's a stereotype, it's a generalization as a whole, right? But there's something that you can learn from that depending on your personality and the approach that you've been taking. right? The more motivated, disciplined, structured, and serious that you take something, it's obviously going to translate into better outcomes. That's not rocket science. What about non-academic indicators like prior healthcare experience or English proficiency? Right? Those do add some degree of predictive value in various cohorts. What about your nursing schools or program factors? Well, schools yielding better outcomes include those who take students with fewer C grades during their prerequisites, who have higher, again, standardized exams, ACT, SAT scores, and those who come from baccalaureate programs versus associate degree programs. And again, this doesn't mean that if you've made some prior mistakes or your scores weren't high, that things haven't changed for you. Again, it's a generalization and looks at trends in how people perform in generalization throughout their training and education. Okay? So if you struggled back then, it means you obviously need to put a little bit more effort now. Okay? Those students who needed to repeat scores had a negative predictive success. I mean, that's not rocket science. So let's summarize those key predictors so that you can consider which ones apply to you and so that you can factor that into your study strategy. Again, academic performance. You have something that you can do about that. You might be like, well, I'm getting ready to graduate. No, I can't, right? I get it. So you have to tighten down and get a little bit more busy in your studying. But those of you earlier on in listening to this, work hard to keep that GPA greater than 3. That would indicate that your chances of succeeding are going to be a little bit higher. Evaluate your performance on these annual or exit exams. Take them serious. It's an opportunity for you to demonstrate your application of core knowledge for nurses entering into entry-level practice, because that's what the boards are going to test. So that helps you to identify strengths, but also helps you to identify weaknesses. Again, while you can't change your age, again, we talked about learn from about those attitudes and the perspectives that older people have, right? I think that's true for anything. As we gain real-world life experience, it does shape us. And there's obviously some maturing that goes on as we get older. Now, if you haven't heard about my topic where I talk about what is actually testable on the NCLEX, that is probably worth giving some time so that you can focus your energy on certain types of content. All right, guys, I'm Dr. Busti, and I hope that you found that quick topic review helpful and relevant. I mean, this is why we're here, to invest in each other, helping medical professionals understand the why so that you can master the how. And the how here is, what can you do, how can you study to pass that NCLEX-RN on the first attempt? Take care.